Trusted, credible, nonpartisan. The Hill's unbiased news and analysis on policy and politics is delivered straight to the halls of Congress with unparalleled engagement in the Beltway and beyond. A new administration, a new Congress, and a new position on healthcare. From enterprise reporting to breaking news to live events, The Hill stays on the pulse of what's next in health. Welcome to The Hill's Health Next Summit.
Let me welcome the Senior Vice President of Editorial Content for The Hill, affectionately known as Super Stretch by George W. Bush, Bill Salmon.
I've been called worse. Thank you, Steve. Good morning, everybody. Good morning and welcome to The Hill's Health Next Summit. My name again is Bill Salmon. I'm the SVP of Editorial Content at The Hill. We're so delighted that you're here today. You know, The Hill does more healthcare events than anyone else in Washington. This is actually one of two kind of amazing facts I want to share with you today. We do more of these than anybody, so we knew coming into 2025 that healthcare would continue to be a major issue, both politically and policy-wise. In fact, that's why we created the Health Next Summit. So we're very excited to have you here, and that's why today we're going to be talking we're going to be hearing from fantastic doctors, lawmakers, patient advocates. We're going to explore some of the healthcare-related campaign issues that were made by the Trump team, and we're really going to dig into some of the issues at the top of the healthcare agenda. You know, I'm talking about women's health, mental health, AI, emerging tech, you name it, we're going to cover it. And in fact, we got so much to talk about that we're going to do this all over again on October 22nd. That's when we're going to do the next edition of the Health Next Summit. So we hope you'll do that as well. I just want to say briefly how proud we are at The Hill of our nonpartisan coverage. You'll see some of that today firsthand. But I want to, one other kind of interesting fact. We grew our audience by 17% last month. And for context, and I had to triple check this to make sure I was giving you straight information, that is literally there's been no larger increase of any news organization, not only in the country, but on the planet. So we had a very good month. We're happy to grow our audience. We're happy to have you as part of our Hill family today and hopefully moving forward. We hope to see more of you. Again, I want to welcome everybody in this room. I want to welcome everybody who's watching on our live stream. If you're following along on social media, you can use the hashtag #TheHillHealth. Of course, I want to give a special shout out to our sponsors, the Alliance for Aging Research and the National Pharmaceutical Council. Their generous support has made this all possible. And now, without further ado, I want you to welcome, help me welcome to the stage one of your hosts for today, The Hill's contributing editor and my old pal, Steve Scully. Steve, take it away.
Just real quickly.
Obviously, when I started covering President Bush, I said to him, you know, I had an interview with him. I said, what is this I hear about you calling one of the reporters in the White House press corps Stretch? Because there was another reporter, Dick Kyle from Bloomberg, who's 6'6", which I call short. I'm 6'7". And he said, well, I guess we'll just have to call you Super Stretch. So for literally the next 8 years, we'd be down in South America at a press conference, and the president would be like, Super Stretch, you know.
Yeah.
So that's how I got the nickname.
A sign of affection and admiration.
Yes.
So,
like I said, I've been called worse.
Now you know the rest of the story. Thank you all. Pleased to be with you all. And as Bill indicated, in addition to working for The Hill, I have a show on Sirius XM, and I rely on The Hill every single day. It is a terrific site. Just some of the headlines today dealing with healthcare. You might have seen it. You may not have. There are 5 high-level officials at the CDC who have now stepped down. The CDC is one of the most trusted public health organizations and government agencies in the country. Here in Washington, D.C., another case of the measles, now joining 18 states with measles cases in this country, and Dr. Oz moving one step closer to becoming the Director of Medicare and Medicaid Services. So you can read all of it at thehill.com. Healthcare, of course, is not just an important issue. It's also something that took center stage at the Grammys just a short while ago. Look at the monitor.
The Grammy Award for Best New Artist goes to Chapel Roan!
I told myself if I ever won a Grammy and I got to stand up here in front of the most powerful people in music, I would demand that labels and the industry profiting millions of dollars off of artists would offer a livable wage and health care, especially to developing artists. And like most people, I had a difficult time finding a job in the pandemic and could not afford health insurance. And if my label would have prioritized artist health, I could have been provided care by a company I was giving everything to. So, record labels need to treat their artists as valuable employees with a livable wage and health insurance and protection. Labels, we got you, but do you got us?
Just an important reminder of the importance of this issue. So some terrific guests here today, including our first speaker, our first Q&A, Representative Diana DeGette. She is a ranking Democrat on a key House subcommittee that focuses on healthcare issues. Welcome. We appreciate you being with us. So welcome back, and let me just begin with the issue that is front and center, which is the Trump agenda, the big, beautiful bill that includes potentially, that's what he's calling it, but potentially could include some significant cuts to Medicaid, the debate over health care, Medicare, and Social Security. What are you expecting?
That's kind of an unfair question, Steve, to ask me. What am I expecting from the Trump administration? We were just opining about how every day there's some new interesting surprise from them.
Are you on Signal right now?
Right. I'm not on Signal with Secretary Herseth or some of the others. But seriously, thanks for having me back again. And I will tell you, it has been chaotic with the Trump administration. But the other chaos is created by the fact that the House Republicans have on any given day just a 1 to 3 vote majority. And so they're trying to do this very big agenda with the slimmest of margins and with an American public that disagrees with them on most issues. So as you referenced in their budget resolution passed by the House, and virtually only one Democrat voted for it and only one Republican voted against it. It said it's a $4.2 trillion budget, and the $4.2 trillion budget is going to be offset by $2 trillion from Congress. And then they said that the House Energy and Commerce Committee would have to cut $880 billion of that. Now, the House Energy and Commerce Committee has jurisdiction over about 40% of the bills that come through Congress, anything relating to the Commerce Clause of the Constitution. But most of the bulk of our budget in energy and commerce is in the committee that I'm now the ranking Democrat on, the Health Subcommittee. And most of that is Medicaid. In fact, coincidentally, the budget resolution told us to cut $880 billion from the Energy and Commerce Committee. The amount of Medicaid is $880 billion. So then we said, excuse us, but over 70% of Americans support Medicaid and don't want to see it cut. In fact, they want to see Medicaid expanded for more populations. So where are you going to get those cuts? The entire rest of the energy and commerce jurisdiction, and that includes the EPA, energy, telecommunications, all of those issues, is less than $500 billion. So any way you slice it, anything the Republicans might say, if they're going to cut $880 billion from my committee, it's going to have to be Medicaid.
So the tax cut issue aside, if you look at the federal budget, Medicare, Medicaid, the SNAP programs, Social Security, interest on the debt, defense, collectively that is about 85% of the federal budget. Can you make some cuts to the Medicaid program without to offset a now $37 trillion national debt?
So in truth, the real problem that we have with this $4.2 trillion budget that they have is that they want to extend the 2017 tax cuts that primarily go to the top 0.1% of taxpayers, billionaires, and corporations. So without, it's economics 101, which I did take that in college. And what that means is if you're going to have a tax cut that large, then you're going to have to offset it somewhere. Thank you very much. That's much better. It's really hard to keep repeating it because the sound system's not working. So if you don't have the revenue coming in, you could cut everything and still not offset that. I come from Colorado, and in Colorado, we have a constitutional amendment that says you can't deficit spend. And I was in the Colorado legislature. We didn't deficit spend. So you can do it without deficit spending, but you can only do it if you have revenue coming in. And that's the problem, is they want to cut the revenue that's coming in by these large tax cuts. There's not anywhere in the discretionary budget that would allow them to offset that.
But isn't the other part of the problem rising healthcare costs, and how do we bring those under control?
Well, there's a lot of things we could do to deal with rising healthcare costs. We could deal with pharmaceuticals. We could deal with a lot of things. But to do that, you can't just do what Elon Musk and Doge are trying to do with their 20-something-year-old kids, is just slice whole things off of the budget. Because when you do that, you harm real people. If you want to try to get some savings in the healthcare system, you have to do the hard bipartisan work of having the hearings, of figuring out where those excesses are, where you can save money, and then try to save money. And we've done that in the past on the Health Subcommittee and on Energy and Commerce. But and I think you should do that, but if you do that, there's no way you're going to save $4.2 trillion.
Do you have confidence in the Secretary of Health and Human Services, RFK Jr.?
So I have confidence in science. As many of your listeners know, I have worked hard over the years in a bipartisan way to make sure that we continue to be the top nation in the world on biomedical research. And all of this needs to be based in science. I worked with Congressman Fred Upton and Francis Collins and others on the 21st Century Cures Act. I'm now trying to work to update that and find a new Republican partner on that. And I believe the research we do at these preeminent research institutions, including the NIH, should be based on science. The issues I have with some of the positions that RFK Jr. believes in, they are not based in science. And I think that is a very dangerous road for our preeminent research institutions to be going down. So,
Congresswoman, when it comes to science, when it comes to research, when it comes to the federal investment in these research opportunities, what we're seeing at universities around the country, what worries you the most over the next 3.5 years? What worries me the most, so the first time Donald Trump was president, there was a general feeling that there was and he had some people who were, like Dr. Collins and others, who were running some of these institutions, who understood how biomedical research works and who understood what we need to do. Those people are gone now. And I think there's a real, number one, there's an ideological bent in some of the people now who are coming into leadership positions. And number two, there's a lack of understanding about what these institutions need to do. And I'll give you an example. A couple of weeks ago, cast your minds back, and
And a couple of weeks ago, the administration tried to zero out the 15% amount that was given to grant recipients for overhead. I got a call from Anschutz Medical Center at the University of Colorado, a huge recipient of NIH grants, and they were telling me when you zero out that 15%, what you're doing is you're zeroing out their ability to get lab rats to run studies, to get the blood supplies, to build the labs. But obviously someone over at Doge or somewhere said, oh, that's 15%. That looks like it's just gravy. I'll cut it. So my concern is the people who are doing this research need to make sure that they are doing it in a cost-effective but science-based way. And you know, I'll say this again. Disease does not impact Democrats, Republicans, or even unaffiliated voters. It impacts every American family. And so we should be doing our biomedical research based on science, not on political ideology.
I don't want to overlook something that you said, and this really gets into the weeds of how Congress works, but you mentioned the 21st Century Cures Act, and you have worked in the past with people like Larry Bouchon and Michael Burgess, Republicans across the aisle. Is that not happening right now in this Congress from your standpoint?
Well, from my standpoint, I continue to try to work with everybody. So, for example, I know that you've got Chairman Carter, Buddy Carter, who's the new chair of the Health Subcommittee, on your agenda today. I've already met with him to talk about Cures 2.1, which I developed with Congressman Bouchon before he retired, but which is ready to go and with a new co-sponsor. So I've met with him to talk to him about that and other issues, important issues that the subcommittee has to work on. I've also met with the chairman of the full committee, Brett Guthrie, about agenda items, as well as Frank Pallone and others. So I'm agnostic about party affiliation if we're talking about biomedical research. The problem with this Congress is we've been spending most of our time dealing with the Trump agenda and dealing with this budget resolution. And so, for example, in my subcommittee and the Health Subcommittee, we've only had 2 hearings so far, and we haven't had a markup. So I do believe there's a potential for bipartisanship, and I'm hoping my colleagues who come here later today will talk about that. But so far, because of the congressional calendar and the Republican priorities, I haven't seen that happening.
And with regard to the research, from your standpoint, where are we today? Biomedical, Alzheimer's, cancer, and the rest?
Well, we are, so much of what has happened in the last 10 years even has put us on the cutting edge of cures for so many diseases. One of the things I do, I'm the co-chair of the Diabetes Caucus along with Gus Bilirakis in Congress. And an issue that I worked on 25 years ago, the issue of stem cell research, has now come to the forefront because there are researchers out of Harvard who have actually been able to make insulin-producing islet cells with stem cells, and they're in clinical trials right now to do that. And if that works, it will cure type 1 diabetes. Same thing with cancer, same thing with Alzheimer's and many, many other diseases. That's why we have to have evidence-based research, and we have to adequately fund it.
You know, ironically, today is the anniversary 7 decades ago of Dr. Jonas Salk, who really cured polio. Do you have confidence that this administration will do what needs to be done to continue the research to find the cures?
I think that's a question for you to ask my Republican colleagues. I will tell you, I intend to do everything I can, and I believe that I have colleagues, Republican colleagues, and also people in the research community who know what needs to be done and believe that they can cause those efforts to be made. But some of the people thought that the NIH budget was sacrosanct, and we saw efforts the first efforts were to cut the 15% grants and to cut other grants that somebody determined were DEI or something else. But then when the courts ordered the 15% overhead to be restored, then the administration started trying other backdoor ways to try to stop this research by not having the grant approval committees meet and other things. We're working through that, but those are delay tactics that we really shouldn't be having when you're looking at approval of research.
So let me conclude where we began talking about Medicaid. What is it, about 70 million Americans are on Medicaid today?
Sounds about right.
So are there ways that we can weed out the waste, the fraud, the abuse, and in some cases perhaps a work to get the benefits for those who would qualify? How do you get the equilibrium in that?
It's interesting because nobody likes waste, fraud, or abuse. I'm against it. I'm against waste, fraud, and abuse, you'll be happy to know. And I think we should continue to have hearings and try to figure out ways we can do it. I will say, cutting the staff that does the inspection and the rooting out of the waste, fraud, and abuse is probably not the way to solve that problem. But also, if your entire budget for Medicaid is $880 billion, you're not going to save $880 billion just by rooting out waste, fraud, and abuse. I've been now in Congress, I'm in my 15th term. I've been here 28 years, and every time the Republicans take over, they say they're going to balance the budget by eliminating waste, fraud, and abuse. Waste, fraud, and abuse is bad, but it's not the top problem in America. And what's interesting is since the Affordable Care Act passed, an increasing number of Americans have gotten their health care through Medicaid, either with the ACA, the Medicaid expansion after COVID. And so now, well over 76% of Americans say you should either keep or expand Medicaid because they know it's helping pay for their insurance. With respect to the work requirement, let me just say briefly, a number of states have tried this work requirement, but what they have learned is most people who are on Medicaid are either already working, or they are disabled, or they are elderly, or they are children. And so pretty much everybody who should be working is working, but what in those states what happened was the paperwork, I don't know, I'm all for paperwork reduction and efficiency, but the paperwork reduction or requirements for those beneficiaries were increased so much, many of them couldn't figure out the system, so you actually had people who were eligible, who were working, who were thrown off of Medicaid.
So if your party has a majority in 2027, is it Chairwoman Diana DeGette?
Well, maybe. That would be my hope, because I think, whether I'm in the majority or the minority, the most important thing to me is to protect health care, make it affordable for all Americans, and to make sure that we have the exciting biomedical research that's going to cure these diseases and save lives.
28 years, you're just getting started.
I know it. My constituents say, when are you retiring? And I say, I'm just getting powerful. Why would I quit now?
A powerful representative. Thank you very much for being with us.
In my own mind. Thank you so much.
We appreciate it. Thank you.